Go.
Unwrapping your favorite candy after a Halloween trick-or-treat, the soft milk chocolate and creamy peanut butter make your mouth water as you take a bite. But what if instead of your mouth watering, your throat closes up and you struggle to breathe? It is said that 2% of children are allergic to peanuts and are unable to eat them without the risk of a severe allergic reaction. Allergies are a common problem that people experience, and especially to dust mites, animal dander, and pollen. But some people can have severe allergic reactions to foods they ingest that can put their life in danger. Allergists around the world help people to understand what their bodies reject and how to avoid and prevent severe reactions. For the past 4 months, I have had the chance to study under a local allergist and learn all about allergens and how they affect the body. What exactly is an allergen? An allergy is an abnormal immune response to a typically harmless substance called an allergen. These allergens can be environmental, like pollen, dust mites, mold spores, animal dander, foods, peanuts, tree nuts, milk, eggs, shellfish, wheat, or some drugs like penicillin, aspirin, insect stings like a bee sting or wasp venom, and other materials like latex or some metals. But why does these exist? It's your body misidentifying the allergen as dangerous. This causes the body to produce a specific antibody called immunoglobulin E. These prime the immune system for whenever the next contact is. During the next contact, it binds to the Ig and releases an inflammatory chemicals, mainly histamine. This is the cause of allergic reaction symptoms. To find out what you're allergic to, physicians use a skin test. The skin prick test, which is most commonly used, uses a small amount of allergen that is placed directly on the skin and then pricked. The patient is then observed for reactions such as redness, swelling, or itching. During an oral food challenge, which is used to help identify food allergies, a small amount of suspected allergen is ingested under medical supervision to confirm an allergy. This is an important test when determining food allergies, which can be the most dangerous types. The patient is fed an increasing amount of suspected foods to test their tolerance or to build a tolerance. This is only held in a clinical setting as the risk of reaction is severe. So now that we know what an allergy test is, let me show you how it is performed. Outside of the preparation room, before you even get your stuff ready, you have to verify the test orders. Make sure that you get the right materials before you give the test. Then you gather supplies, such as a positive control, negative control, the sterile lancets, the skin markers, alcohol pads, gloves, test documents, a timer, and emergency supplies, such as an EpiPen in case of a severe reaction. Then you check and prepare all of the allergen extracts. Prepare the work area, organize your supplies for a quick administration. Once you get into the test room, you check up on the patient, ask them their name, date of birth, and how they're doing. You also have to make sure that they haven't taken any antihistamines in the past 5 days. Otherwise, that may affect results. Then you explain to them the procedure, the prick that they would feel, the itching and discomfort, and the importance of not scratching. Place a small drop of the allergen extract on the coordinating circle, and then take a lancet and scratch the surface. Just enough to poke the skin, but not to cause bleeding. Do this for each test, including the positive and negative controls. Leave the patient for a while until the timer goes off, and then record the results. If itching occurs, apply an antihistamine or hydrocortisone cream for the patient's comfort. Now that we know what an allergy is, an abnormal immune response to a usually unharmful substance called an allergen, and how an allergy test is performed, let's talk about what the results mean and why these tests are important. The results are classified by a redness and wheal, which is a raised bump on the scale. Negative means no reaction. There's no redness, no wheal. Minimal means very slight redness, no bump. Mild positive means a small wheal, about 3 to 5 millimeters, and clear redness. Moderate positive is a larger wheal with surrounding redness, about 5 to 8 millimeters, and anything larger than that is a strong positive. So why are these tests important? These tests can help people know what they're allergic to and so that they can avoid certain foods or animals, trees, and pollen and stuff. This can also help patients get EpiPen practice so that they can administer themselves a life-saving dose of EpiPen to help keep them alive before the EMS gets there. They can also help them prescribe daily pills such as Zyrtec and Zysol for daily allergies for pollen and dust. Through this demonstration, we have learned that allergy testing isn't just about finding what makes someone sneeze. It's a key tool for improving quality of life and preventing serious reactions. You now know what an allergy is and what tests are, the steps of the skin prick test and what those results mean, and why those tests are used. An allergy test is an important test to help allergists determine what allergies people have and how to prevent severe reactions. Although the process may seem routine, allergy tests is an essential tool that allows doctors to prevent severe reactions and promote long-term well-being.